Turning now to the Ebola crisis, the U.S. ambassador to the United Nations is calling attention to the need for greater response to the Ebola outbreak that has killed nearly 5,000 people in West Africa. Samantha Power posted on Twitter early Monday after spending a day in Guinea that the scale of need is staggering and that the most basic resources will help save lives. Power is on a multi-stop tour this week of the worst-hit countries, including Sierra Leone and Liberia. Power's visit to the West Africa comes amid a decision by the Governor Andrew Cuomo of New York State to revise the state's controversial new quarantine policy on healthcare workers who return to the United States after treating Ebola patients in West Africa.
A healthcare professional who returns to this region who had exposure to infected people, or citizens who are returning or coming to the U.S. who had exposure to infected people will be asked to remain in their homes for a 21-day quarantine period. During those 21 days, healthcare workers would check on them twice a day.
Well, the updated quarantine guidelines come just 2 days after Mr. Cuomo and Governor Christie of the neighboring state of New Jersey first jointly announced the initial quarantine measures. Their decision immediately put them at odds with the top U.S. health officials. Now, viewers, Michael Bowman has more.
Fears of possible Ebola contagion in one of America's largest and most densely populated cities, New York, led Governor Andrew Cuomo and New Jersey Governor Christie to strengthen quarantine measures in their states.
This is too serious to be dealing with voluntary quarantine. I mean, it makes no sense to me. We are significantly increasing the screening process for people who want to come into the New York, New Jersey area.
We have the legal authority to do it. We're doing it.
Triggering concerns, Doctors Without Borders physician Craig Spencer, who is being treated for Ebola in the New York hospital while his fiancée remains under house quarantine. Meanwhile, complaints from a nurse who returned from Sierra Leone and is now under mandatory isolation in New Jersey. Casey Hickox ran a fever but has tested negative for Ebola. She wrote a U.S. newspaper that, quote, "The U.S. must treat returning healthcare workers with dignity and humanity."
One, we need to protect the American public, but two, we need to make the decisions based on scientific data.
U.S. infectious disease specialist Anthony Fauci is critical of quarantine protocols in New York and New Jersey.
The scientific data tells us that people who are without symptoms, with whom you don't come into contact with body fluids, are not a threat. As a scientist and as a health person, if I were asked, I would not have recommended that.
Last week, President Barack Obama hugged cured Ebola patient Nina Pham.
We have to work together at every level, federal, state, and local. And we have to keep leading the global response, because the best way to stop this disease, the best way to keep Americans safe, is to stop it at its source in West Africa.
But New Jersey Governor Christie is defending his decision to boost quarantine protocols.
My first and foremost obligation is to protect the public health and safety of the people of New Jersey.
Stop Ebola! No!
As U.S. fears over Ebola continue, African immigrants march to the United Nations, decrying stigmatization they perceive from society at large. Michael Bowman, VOA News, Washington.